everyone. Welcome to another episode of
Health and Wellness 360 with Tfal and Chi.
Our mission is to empower you to be the very best version of yourself
by providing you with practical and tangible tools to live a healthy lifestyle.
To learn more about us, go to www.tfalandchi.com.
And now, enjoy the show. Hello, good morning. Good morning, everyone.
Good morning.
And welcome. Thank you for joining us this Saturday morning on Health and Wellness 360 with Tfal and Chi. Thank you so much. And please let us know where you're joining us from. We appreciate you joining us. But before we start this morning, we would like to remember those who lost their lives and the families on 9/11/2001. So 20-year anniversary in remembrance of those who lost their lives, the families that have been affected and impacted since then, and all the frontline workers and all the people who were involved in 9/11/2001. May their legacy live on and may they never be forgotten. And all the frontline workers who are continuing to do the work during this COVID times, we thank you for your service, and may the souls of the 9/11 victims rest in peace. So thank you so much. So again, thank you for joining us. We see a few people who have already put us where they're joining us from. I'll start by introducing myself. My name is Tfal. I am an infectious disease physician, professor of medicine, and author, podcaster, wellness coach, and the other half of Tfal and Chi. And I'm joined here by my amazing husband, Chi.
Yes, hello everyone. So good to be here today. And thank you so much for always being here to support us. You guys are amazing. You are part of our family. You are now part of the Tfal and Chi family. So thank you so much for being there. I am Chi, and I'm a health and wellness expert, and I'm a director of wellness. And my focus is on being able to, empower you to be the very best version of yourselves. And that is what we do. Our mission at Tfal and Chi is continue to grow our health and wellness community, give you tools that are deliberate, that are sustainable, to make those changes that are super important for you and your family. The reason we do this as Tfal and Chi, why we're so passionate about what we do, is that chronic disease continues to be so pervasive and prevalent in our communities, especially our communities of color. We cannot do this alone. We want you, as part of our family, to be part of this fight. Chronic diseases such as obesity, high blood pressure, heart disease, asthma, complex cancers, all these are areas where our communities of color are suffering so much more than any other communities out there. We need you to be part of this fight, to help us share a message at all times, to share this, starting with your microsystems, your family, your friends, and be able to share these messages, inculcating plant-based, dietary plans into your families, exercise, mental health. And we know that there are systemic issues that impact this, socioeconomic issues that make this, a problem in our societies as well. But you have the power within you and your families to begin to fight back. But we need you to help us in this fight. This is why we do what we do, and we're going to continue to do this every single day. And every time we come here, you are you're part of our family, and you're helping us in this fight.
You totally are. Thank you so much, Chi. And for those of you who were with us 2 weeks ago, we talked about you at your doctor's office. That was part 1. And today we're going to go into part 2. And we closed, that session talking about how to empower you, so that when you make those appointments and when you have those visits, you are empowered and you have the tools to be your own advocate at the doctor's office. We talked about being prepared, coming with your questions, and the importance of a trusting and honest relationship with your healthcare provider. And so as we go into the second part and finishing up that segment on you at the doctor's office, would like to ask a question and have you participate by putting in the chat. Many of us have had at least one time when we've had a medication prescribed, right? Some people are on chronic medications, but most of us at one point or the other had antibiotics or medications prescribed. How comfortable were you with what you were prescribed in terms of understanding why you were on it and the instructions you were given? So if you could put in the chat how comfortable you were with understanding the instructions, and we'll talk a lot more about medications.
And thank you for all those who have been putting in where you're dialing in from. We love you guys. Just keep letting us know where you're coming from. And just from the question my wife just asked, how comfortable are you with, the instructions you're getting when you get scripts written for you? So this week, my lovely wife remains in the hot seat. So I'm gonna have to pepper her with a bunch of questions, all right? So that's what we're gonna do today. And but before I go into the idea of medications and script writing, just a couple of things I want to share with you today about the numbers and the prevalence of prescription writing. When it's indicated, it's awesome, but there are things we can do as as a society where we can prevent and do things within our communities and environment to make sure that we don't get to a point where we have to rely on medications. But when the medications are indicated, it's great. Today, especially in North America, there are over 4 billion prescriptions written every single year. 4 billion prescriptions written, right? And another stat I want to share with you, from ages 40 and up, 1 in 5 Americans actually are on more than 5 prescription medications. 7 out of 10 on 1. So think about that. 1 in 5 are on 5 or more prescription meds, and 7 in 10 on 1 prescription med. And the highest prescription med that is prescribed out there is a lipid lowering prescription, a lipid. And this is why we do what we do, cholesterol, right? And why, so that's why we, our program connects all these dots, what we eat, mental health, how we move to help in all these spaces. But today we're going to focus on the space of if your medication, what that means to you. So let's go ahead. And so I'm going to ask my wife today. The first question we're going to go into is, when it comes to what do you want our audience to understand about if and when they are prescribed medication, what do you want them to know about that and the import of that and that physician-patient relationship and that we talked about. Can you share some of that?
Thank you so much for those stats. And the stats you mentioned are those on prescription medications that we know of.
Correct.
And then we know that over-the-counter medications are up too. If we look at things like, gas medications and things for arthritis and things that are buying. But a lot of those are actually up also related to our nutrition and things like that, where we have a lot of, heartburn and things like that. So the things we talked about in our shows on healthy eating and gut health, a lot of those things we're managing the symptoms by buying over the counter. So a lot of medications. So, we could talk about medications for a long time, right? But 5 things that I would really like people to know, we could talk about a lot more, is one is to let us know when you're in your doctor's office, let your doctor know, and they should ask what other medications you're taking, including over-the-counter meds, and we'll talk about why that's important. And we will ask you about your nutrition, what you're eating. We'll talk about alcohol. We'll talk about tobacco. And sometimes people are like, I just need a script. Why are they asking all these things? We'll talk about that. Second is we may need additional blood work. So you may say, but I got blood work. There's certain medications we need monitoring. We need to look at safety. We may need more blood work. The third thing is that sometimes less is more. Actually, most times less is more. So we don't want to just throw scripts at everything. And there are times when medications will not be prescribed, but lifestyle interventions will be put in place.
Sure.
And we cannot prescribe a medication because you saw it on TV, or because your friend or family member is on. We can talk about that, even if you have the exact same diagnosis. The fourth, which I think is really important, is we want you to adhere to what you're prescribed. And we'll talk about why that is important, to adhere to the dose, the regularity, all of that. And the final one is if you stop taking your medications, to let your doctor know, because we can look back and all that. Because what we're worried about and what we worry and think about when people are on medications are 2 big things: the efficacy of the medication, so how well it works, and the safety. So all that we're looking at is efficacy, safety, and there are other things we look at. But when we talk about monitoring and looking at blood work and having a way to prescribe, it's so that we're getting the efficacy or the medicine is doing what it should do, but at the same time, it is safe for you, the person ingesting. So those are just a few things we would like our audience to know.
There was something you said.
Okay.
Thank you. It's okay. No worries. So there was something you said about, because we know that sometimes we're on medication, and oftentimes the physician doesn't know what we're eating at home, right? Can you just dig into a little deeper why there has to be that knowledge about what we're being prescribed and potentially what we're eating and what's happening at home? Because we know that over 98% of healthcare happens outside of the doctor setting, right?
Yes, that is phenomenal. And we talked about that last visit, right? That even if you had 5 visits a year and you had a whole hour with your doctor, which doesn't happen anymore, unlike in the old days, that 99% of the time, 98% are you're managing your health by yourself, right? You're taking your meds, working on your nutrition and lifestyle. So it's really important to know what are the meds, because we talked about safety. So when we need to know what other medications you're taking, that's because there could be medication interactions. So we're prescribing one thing, you get something from somebody else. It could be a specialist, it could be over the counter. If we're not aware of that, that drug, we call them DDI, or drug interaction, could harm you in 2 ways. One is that interaction could make the level of one medicine higher, so all of the side effects are higher, or it could make that other medication be excreted from your body quicker, so it's no longer working. So you're on the same dose like you should have been, and all of a sudden your blood pressure is in control, your blood sugar, because you're taking something that interacts. So other medications, if we think about the process from taking a medication, absorbing it, metabolizing it, if you have sometimes things like antacids, supplements, calcium tablets, Tums, iron tablets, sometimes they bind things in your stomach, so you don't have the efficacy of the antibiotics. Things like grapefruit, which are great, you may not have, you have to separate from your meals.
Let me ask you this real quickly. You just said antibiotics, right? So can you share a little bit about antibiotics and also the import of finishing the dose when that's prescribed? Because sometimes we're prescribed antibiotics and then we take it a couple and we feel better and we just put it away.
Why is that important?
Why is that important?
It is, an infectious disease. So more than other kinds of medications, antibiotics, antivirals. So, the studies before a medication is approved for a certain indication, we've done a lot of studies to say you need, for this infection, 5 days or 7 days or 10 days. And that is studied to know that is the amount of time that you need to completely eradicate the infection and make sure it doesn't recur. So when you feel better in 2 days, which most times people do, and you stop taking it, a couple of things happen. You have a higher rate of relapse because the infection may come back. Second is what you end up doing, because when that happens and you take it again, is you increase the chance of antibiotic resistance. And we're starting to see that. And the third thing is that what happens then, people leave meds in their cabinets, and then a friend says, oh, I have a cold. It's like, oh, this worked for me, take that. And so all of those things are things where it's important, not just for antibiotics, but for other things, to ask the questions when you ask that, when you get that prescription, am I taking this for just one time?
Right.
Is there going to be refills on this? And what else? But more importantly, when we ask about food and alcohol, is 2 things. Some medications require that you take it with food in your stomach. It improves the absorption. Some need you to be on an empty stomach. But also, it's a chance for us to find out what you're doing outside of the hospital. If I'm prescribing cholesterol medicines to you, and I don't talk about what you're eating every day, and find out that we're not doing anything to improve your lifestyle, that's doing you no service. So we need to know about that.
So clarity is so very important, right? Understanding what has been prescribed to you, whether it's over the counter or from the doctor's office. It's very important to ask questions. Asking those questions is a sign of strength.
It is.
It is a sign of strength. Ask questions. Ask the doctor, ask the pharmacist, so that you have complete clarity about what you're taking so it's most effective for you when and if you need it.
And a lot of us, when we go in, if you remember, you know, a lot of times the pharmacists, as you're signing for the stuff, they always say, do you have any questions? And most of us, because we're busy, we're running, we've been in the drive-through line, you've been waiting, you just say no. That is another chance. If you're in the doctor's office and things were rushed and you didn't get your questions answered, the pharmacists are trained. They always ask you, do you have any questions? Even if it's a medicine you've been on, if you do, ask them. They have people who do the counseling. And alcohol is one thing sometimes as doctors we get pushback. They're like, why do you keep asking? It's important because, you know, if you think about the organs that get rid of medications or excrete them, liver and kidneys. That's why you know, we need additional blood work.
That's right.
But also alcohol is such a big compound that your body has to break in the liver.
Sure.
So if you're drinking and with the medications, the toxicity is higher. Even things like Tylenol, when you're taking high doses of Tylenol and you're drinking. So sometimes we ask these questions for the safety aspect of things.
Correct.
Sometimes with medications, we have to do a pregnancy test because some medications can be. So sometimes people get a little offended, like, why are they asking all this stuff? It's about not just the efficacy of the medicine, but the safety to you as a person.
Sure.
So we have to monitor these things.
That's right. And just another comment in terms of medication. And sometimes in our lives, we have to go through surgery.
Yes.
And we're prescribed medication. It's very important to also ask questions because some of us are able to just do over-the-counter medication and some are not able to. If you're able to, ask your doctor those questions. Can I do over-the-counter pain meds?
Correct.
Versus using the stronger, you know, pain medications. All right. So just ask. So very important. Just ask. It's very, very important. Isn't it?
It is. It is. And I know that producer Ellis had put a comment on the screen that said, let us know if you stop taking medicine, because that is something that is a big cause of readmissions to the hospital and a lot of things like that. And so and that's that importance of that trust, right? Sometimes people are not comfortable enough with their doctor to say, I stopped taking it. Because when you say that, it allows us to say, well, why did you stop taking it? Were you having a side effect? Was it that you couldn't afford it? Was it that there was something about it that made you feel a certain way? Was it that you were talking to a friend who said, I don't like that medicine? But the answer to that question allows us to say, do we need to send you a social worker or try and get you coverage from the drug company? Two is, your friend is on a different medicine, but this is why you need it more in depth. Is it because you're having a side effect? Do we need to switch to something else? Do we need to lower the dose or do we need to stop it at this point? But having that information allows you to be safe because medication issues cause a lot of falls in the hospital and people getting admitted because things are not in congruence.
Exactly. And, you know, every time, you know, my wife is on the hot seat and I'm asking her a question, there's something you just talked about in terms of, side effects.
Yes.
So when you prescribe medicines, right, and you go to the pharmacy and you get your script, you find that it's almost like a booklet, all the side effects and all that. It's scary. Some of them say even up until, some of them may even cause death, right? So there's so many side effects that are noted there. And that is why the clarity of what you're taking, discuss and having those conversations so that if you have any one of those side effects, you know what's going on. And maybe you have to go back to maybe have something, maybe a lower dosage or something that is not as strong to mitigate some of those side effects and some of those things. Is that correct?
It is so correct because even though that was not, as soon as you said that, it brought up something else, just a personal example of when people have had side effects without going back to the doctor or calling up the office and saying this is going on, just stopping. But sometimes, you know, you have diabetes, you have kidney issues, stopping it without having a plan as to, do I need to switch? Is there something else I can do? Doesn't stop whatever it is from progressing. So it's the worst thing we can do to just stop it without talking about it because there are other options. Sometimes there are things that need to be changed. It may just be more clarity about, you were taking this other medicine, this can happen, or you need to take it with food so the side effects are better. But talking about it, that's really important, and not just ditching things, but being able to ask questions. So that was an extremely important one, because it's one of those things that when people have better clarity about it and know why they're on it. I'll give you an example, right? Someone comes in, and that's the one about people saying, well, my friend has this and they're not on meds. So it goes back to some of the things we talk about, the importance of screening and coming in for your visits. And I'll put you on the hot seat for the make it make sense. Yeah. But a person walks into the emergency room with what seems like 3 days of urine complaints. They think they just have a urine infection. When they get into the ER, they do all this stuff. They realize not just they have a urine infection, but the reason they do is because they have diabetes. And by doing their blood work, they see now that they have kidney issues, they have slightly elevated blood pressure, their cholesterol low. So they walk into the ER with 3 days of symptoms. They live with 4 or 5 medicines because they have all these conditions. In their mind, oh, that hospital, I went in there, they gave me all these meds. The issue is, when we say, like, I didn't have any medical problem, when was the last time you had your annual exam? People will tell you 5, 6, 7, 10 years ago, when I had a baby 10 years ago. Yeah. So we're not getting the chance to intervene, to prevent the diabetes. When they get to pre-diabetes, to talk about it so all of a sudden it's like, I had a UTI and they gave me 6 meds. Yes. Because we picked up a whole bunch of things. The importance of screening. Yes. And being able to intervene before we get to all of that. That's right. And diabetes is one of the highest prevalence right now. And the trajectory is that by 2050, 1 in 3 Americans will be suffering from diabetes. That is scary. And again, these numbers impact our communities of color more than any other communities out there. And a lot of it, like I shared at the beginning of our show, socioeconomic issues, lack of access, poverty, a lot of things are baked in there. But there are things we can do together as a family. Like I said, you are part of our family now. Yeah, we got to do this together. We do this together, right? So I'm going to put you on the hot seat. I'm good for it. Let's do it. So as we're getting towards, again, time is flying. And if you have questions about medications, please put them in. Yeah. Why it's important to know our numbers. So I would like to have you as a consumer say, why is it important for us to know our numbers when we go in for these visits? We've talked about medications, we talked about all of that stuff. So what numbers and why are those important? So you can see this. You can find this actually in our store at www.tfalandchi.com, and you can be part of being part of these messages. If you wear this anywhere in the world, you're sharing that message. You're reminding people to do this. So the importance of understanding your numbers is that having a baseline. If you have that relationship with your physician and you have your blood work drawn, it's very important to ask, so what are my numbers? Because oftentimes our physicians will not call us and say, hey, this is going on, because there was nothing that was worrisome. But whether your blood work is good or not, it's important to understand what those numbers are. What your A1C is. We talked about that. What your blood pressure numbers are, if they're within the normal range of 120 or 80, if they're there. What your waist circumference is. It's important, right? It's very important to know those numbers, your pulse rate, so that the next time you go to the doctor, you can compare those numbers. You have a history, right? Yes. And when you have a history, you can tell if there are things in your life or your environment that you can change to make those numbers even better, right? So what we encourage people to do, and we practice in our own lives, no matter how good those numbers are, there's always a chance to make them better. Is that correct? Absolutely. Always a chance to make them better. So if your A1C is below 6, right, how can you make that even a few ticks better? If your blood pressure is at a good range, how can we even make that even better? We can always get better. Always. And that is what we're trying to share. It's important to know those numbers so you're an educated consumer. So you're spending less time and also less monies on trying to be healthy because you're doing the right things. You're not engaged. You are super engaged and you know what to do and how to do it. Starting from your family, sharing those generational things so that
we become more healthy as a community and as a family.
And you have a lot of experience, years and years in insurance and utilization management, and how these tests, these simple tests, are things that if people knew those numbers and were able to act on, would decrease the cost of hospitalizations later on and spending in retirement.
Yes, 100%. Because when you know these numbers, right? If you know that, if for instance you feel that your waist circumference is not where it should be, then you know that perhaps moving more, because moving is a form of vitamin, actually. It's a kind of vitamin. Our body needs different forms of movement, right?
Yes.
So it's not just walking. It could be just, going up the stairs. It could be yoga. So we want to involve different kinds of movements within our system. So it's vitamin walking, vitamin crawling, vitamin gardening. Every kind of movement we do is a kind of supplement for our bodies, because our body requires different kind of supplements to be good. And exercise, mental health, the kinds of foods we eat, all are very important in terms of how we make these numbers better.
It is. And when we talk about, how fab are your 5 or how fab, it's really about normalizing knowing our numbers and taking ownership for those. We joke about it sometimes, that's like, it's like know your credit score, right? We talk about you don't have to know your credit score, but we know that when you know it, you know the impact on both your short-term and long-term, ability to do things.
Sure.
So when you know these numbers, then you know, well, what should it be? Then what is mine? How do I get mine better? If they're not good, how do I get them to better? Because you know that when your numbers are great, your health is improved both short-term and on the long term.
We have 3 minutes to the show. This show moves so fast.
It does.
We have 3 minutes left. So within the 3 minutes, we're going to share a couple of things with you, right? So why don't you go ahead, honey?
Yes.
Why don't you start?
So I'll start and just finish up within the 1 minute that I have, that we hope that when you do make those appointments with your physicians and your advanced practice practitioners, that you go prepared. You ask questions in the office as you're getting your vitals done of the physician, of the pharmacist, that you're keeping record of your numbers, you're understanding where they should be, and that when you have questions about your medications, it's important to know for everything you're prescribed, why am I taking it? How long am I taking this for? How should I be taking this? And if I have side effects, how do I get back with you? Because those are all the things that allow you to be safe. In addition, knowing that because you have a medical condition and medications does not mean that you don't start to continue to work on your lifestyle to improve what you eat and move more and sleep better, because you can get off certain medications. You can reduce your doses. You can. It's not I'm done for. So it's important to be empowered, and we hope that we did that with this 2-part series on what happens at the doctor's office.
Sure. And what I want to share with you is remember, we share this on every show, EMTS, right? So you want to eat well, you want to move as much as you can, you want to think about your purpose, because when you have a purpose that is not just about yourself, but something bigger than yourself, giving back to your community, helping your fellow man, sharing this message so other people can be healthy, and also making sleep a very important component of your life. Sleep is super important. It's not just what we eat. It's not how we think and feel. It's not how we move as well. But all of it is all connected. It's all connected to make you the very best version of yourself. So thank you so much for being here, being part of our family. Share this message widely with as many people as you can. Think about those who were impacted by 9/11. Pray for them. We love you guys. Thank you for always being here with us. We love you. Thank you for supporting us. We can't wait to see you again in a couple of weeks.
We'll see you in 2 weeks. It will be our 10th show, and it is going to be phenomenal. Bring your friends, bring your family, and just be there in 2 weeks when we come back for our 10th show. And we hope that you have enough tools and tips to step out today and start making those changes in your life.
Thank you.
Thank you so much.
Thank you. We love you.
Thank you.
Yeah.